podcast summarises the UK four-nation child welfare inequalities research project. The project was focused on the relationship between poverty, deprivation and social work decisions to intervene in children's lives, specifically in relation to care and protection proceedings. Professors Paul Bywaters, Kate Morris and Brigid Featherstone describe the project, discuss the main findings and consider the implications for policy and practice. The project was funded by the Nuffield Foundation and a resource sheet is provided to accompany the podcast. The sheet has links to the main outputs from the project and other relevant material. We've also provided a series of questions that we would really appreciate you taking time to answer. This will help us think about the ways in which the research can continue to help social work practitioners, managers and policymakers. For more information and to follow the developments, follow BASWA on their Twitter feed at BASWA_UK or at Facebook at facebook.co.uk/BASWA.UK.
Well, we're very used to thinking about how unequal people's chances are of living long and healthy lives. Reducing health inequalities is well-established government policy, whichever party is in power. And it's the same with education. There's a central policy focus on closing the gap in attainment between disadvantaged pupils and better off children. But in relation to children's services, we've never had this focus on inequality. And in fact, even though in one sense everybody knows that poverty is a key factor in family life, there have been several years in which the importance of poverty in child protection has been denied. It's been talked down by senior politicians, some senior leaders in the profession, some researchers even. But when you think about the fact that a child in Blackpool is 8 times more likely to be looked after than a child in Wokingham, 8 times more likely, it's clear that there are profound inequalities in children's chances of having a difficult and damaging childhood. Now, these inequalities have never been quantified or investigated. So that's what we set out to do. We wanted to quantify, we wanted to say just how big are these inequalities, and we wanted to try to understand how they occur and why they occur, not only in England, but across all the 4 UK countries. So we were looking at England, Scotland, Northern Ireland and Wales, and inequalities between the countries, between local authorities in each of those countries, and between neighbourhoods and ethnic groups as well.
60s, it was about paediatricians discovering battered babies and locating the causes within what their parents were doing. It was a very kind and compassionate project. It was very concerned about these vulnerable parents, but it was very clear that it was something about how they themselves had been raised and how they were unable to empathise with their own babies because they hadn't had a good childhood themselves. And the essence of that, which is a very individual, inward focus, looking at what happens within families and within homes, that had stayed had actually, if you like, morphed alarmingly when we entered a different period where parents were not seen as worthy of understanding or of compassion, or were more seen as responsible. So what was exciting about this research was that it was looking more systematically and systemically at who was being interacted with and starting to open up questions about why they might be being interacted with, rather than a very individual focus which located it within risk factors in individual families. And the irony of that was that social workers were going into lots of families in the same places and not joining up the dots. They were bringing the same very individual lens to individual families, rather than thinking, well, how come there are so many families and children in this area who are experiencing interventions?
There's probably 2 publications for folks to look out for. One was the early findings from the initial pilot study that Paul led from Coventry University, and the other probably is the Reimagining Child Protection book, which Brigid authored with myself, Kate and Sue White. Paul, can you describe the way in which you completed the research using the data? Can you just do a quick guide to how you conducted the quants, and then I'll talk about the case study.
Okay, so we had two big parts to this study. One was a big number crunching exercise, and that's what I led. And the other part was the case studies that Kate's just mentioned, which were looking at in depth at what was going on in practice in particular places. So on the number crunching side, we collected data on every child who was on a child protection plan or register, or who was being looked after in 2015, in a representative sample of 18 local authorities in England, 10 local authorities in Scotland, covering half of all Scottish children, and all the children in Wales and Northern Ireland. So this was a really big study with very large numbers of children that we collected data on. And we wanted to know whether factors like their age, like gender, like ethnicity, and other factors about where they lived affected their chances of either being on a child protection plan or being looked after. Now, we also wanted to make a link across to their family socioeconomic circumstances, as it's called, to poverty, to their income and their housing conditions and so on. And extraordinarily, there's no data collected about the families of the children that are worked with by children's services. So what we had to do was to link the circumstances of those individual children that we had information about to the small neighbourhoods in which they lived, each of which has a deprivation score according to the UK Index of Multiple Deprivation, as it's called. So by the time we'd done all this, we'd collected data, as I say, on the characteristics of the children, their age and gender and so on, and on their ethnicity, and on the deprivation of the area that they lived in. And then we did a big sort of statistical analysis to see how these various factors were linked together. And that was how we did the number crunching.
So, in order to better understand what was happening at the point of practice and whether we could see any differences that might explain these unequal rates, we very carefully chose 6 local authorities. And within those local authorities, we chose 6 sites that we knew were directly comparable in terms of population and in terms of levels of poverty and deprivation. And we had a set of research tools that we used in every one of those sites. So all the social workers in each of those sites completed a focus group looking at a case study. We observed their practice. We asked them to map out local resources and local decision-making processes, and we attended key decision-making meetings. We also collected visual data about the sites, and we talked to senior managers about the sites and gathered from them a kind of narrative about the sites that we were in. And in order to really understand the relationship between poverty and social work decision making, we also spent some time in the most affluent areas in each of the local authorities and the most deprived areas in each of the local authorities. And that was really to make sure we had a range of data about the relationship between poverty and social work decisions to intervene.
Okay, so out of the study of the data on these large numbers of individual children, there were 5 important things that we found. The first is that children's chances of being looked after on a child protection register or plan varied greatly between the countries, between the 4 countries of the UK for any given level of deprivation. So for looked after children living away from home or living away from relatives and friends, so these looked after children, rates in Scotland were the highest, then Wales, then England, and finally Northern Ireland. So there are proportionately more than twice as many children being looked after away from home in Scotland than there are in Northern Ireland. If England had had Northern Irish rates of looked after children, there would be 40% fewer looked after children in England. You can imagine that these are huge differences, and the cost implications of those are enormous. And we're now investigating these country differences further in UK studies, particularly in Northern Ireland. So that's the first finding, that there are really big differences in the proportion of children in care on child protection plans across the 4 countries. But secondly, within each country, in every local authority, in each one of the 4 countries, we found that deprivation makes a huge difference to children's chances of involvement with children's services. So in England, if you live in the most deprived 20% of neighbourhoods in the country, you're over 8 times more likely to be on a child protection plan or to be looked after than in the least deprived 20%. It's similar in other countries, slightly more, slightly less, but it's around the same thing. So these are huge differences, as I say, over 8 times between the most deprived 20% and the least deprived 20% of neighbourhoods. So deprivation, family income, employment, debt, housing conditions have a huge effect on demand for children's services and on children's lives. The next key finding is that this is what we call a social gradient. It's not an either-or difference between families in poverty and families who aren't in poverty. Each step increase in deprivation from the bottom right to the top brings an increase in children's chances of a difficult childhood. So policy and practice needs to be proportionate. If you target only the most deprived 20% of neighbourhoods, you'd miss almost 50% of the families who need support. But if you don't give many more services to the most deprived 20%, you'll perpetuate these huge inequalities in children's and parents' life chances. So there's this social gradient. The 4th thing we found was that there are huge inequalities between ethnic groups as well. Some of this was because children from most minority ethnic groups are much more likely to be living in poverty with insecurity of income and poor housing conditions. But after you strip away the effects of poverty and deprivation, you find that children in Indian, Pakistani, Bangladeshi, Chinese, and African families are very much less likely to be looked after on a child protection plan than white children or children of mixed heritage. And these are, again, huge inequalities which receive little or no attention and which we need to do much more to understand better. And finally, we found the thing that we call the inverse intervention law. And this is a bit complicated, but I'll do my best to explain it. When you compared affluent local authorities with deprived local authorities, as you'd expect, the proportion of children receiving services was much higher in the deprived local authorities on average. However, if you compare similar neighbourhoods in high and low deprivation local authorities, surprisingly, it was the low deprivation local authorities that had more children on child protection plans and more children in care. As I say, we called this the inverse intervention law. And this was the particular focus of the case studies which Kate led to try to look into that further. So Kate, can you tell us a bit more what you found in those case studies?
I can, Paul, thank you. So the key themes coming from the case studies, and it's important to remember that we can be confident about these findings because we had directly comparable case study sites. And the first was that we're describing really poverty as the wallpaper of practice, that it was both unremarked on and unremarkable. All social workers routinely focus their activity on neighbourhoods where poverty and deprivation were key issues. Secondly, in all the sites, we saw social workers preoccupied by rationing, by trying to control the level of demand, by dealing with issues of demand outstripping supply, and feeling very stressed and talking about unmet need across all the sites. Thirdly, reorganisation was endemic in these sites. In all our case study sites, some form of reorganisation was occurring. And what's important to remember is that that's not just stressful and unnerving for staff. It can often fracture and change relationships between families, communities and services. Fourthly, and probably the most important finding from the case studies, is whilst we can see some variations in local practice, we could not see sufficient variation to explain the unequal rates of intervention. And that's very important when you think about where the change needs to occur. So whilst we could see some different approaches in terms of case study methods, in terms of local service configurations, in terms of local decision-making processes, ultimately the responses to families where poverty and deprivation was an issue had far more in common than they had difference. Fifthly, we found that social workers can articulate the relationship or their analysis of the relationship between poverty, deprivation and child abuse. But this was rarely played out in plans. So why social workers can articulate the impact of poverty and deprivation on children and their families in the abstract, when it came to care planning or child protection planning, we could not see any evidence of that informing those plans. There were also some routine practices that made the impact of poverty and deprivation harsher for families. So there were routine practices concerned with families' travel costs, contact arrangements, attendance at meetings, that made those experiences more difficult and indeed more shameful for families because of their lack of resources. Funding to get to meetings, funding to have a meaningful contact with a child, multiple examples where if we poverty-proofed our approaches to families, we might just reduce some of those more intense experiences of shame. And finally, we could see a gap in social workers' understanding of the impact of poverty and deprivation on child abuse and neglect. There is a knowledge gap, and it's something as academics and as policy leaders we need to pay attention to. A better grasp of the body of literature and evidence that informs us about the relationship between child abuse and neglect and poverty would help social workers strengthen their analysis and understanding of the problems families face. There we go. In light of that summary from Paul and I, do you want to outline what you think the key implications of the study are, both for policy and for practice?
Yeah. At a policy level, I think I've already mentioned earlier on the tendency to think very individually, that child protection is about looking at what parents do or don't do, whether it's intentional or not. And as I've said already, in the past, it was perhaps a more sympathetic approach to parents, that perhaps it was seen that they couldn't help it, that they hadn't been cared for well themselves. In more recent decades, it's been an intentional approach. It's that parents are choosing to neglect their children, choosing to not look after them, or indeed choosing to harm them. And there's been a tendency, and this has become very obvious since 2010, there is a disconnect at the level of policy between what parents do or don't do in the home and the context in which they're living their lives. So it has been perfectly possible for successive governments to say, particularly since 2010, although this is much more long-standing, but if we look just since 2010, it has been very possible for successive governments to say, we're improving child protection at the same time as they have embarked upon a very wide-ranging programme of cuts and of austerity, and for them not to make any join up, not to see that if you are increasing the numbers of children in poverty, if you're increasing the difficulties that parents, say, with disabilities have to get access to benefits, if you're decreasing the possibilities of people having safe and secure and indeed healthy housing, that you may actually be impacting upon people's abilities to look after their children safely. There's just this massive disconnect. So our project is very much saying you have to join the dots up and you have to think across government And you have to look at the context in which families are seeking to care safely. What is their housing like? What is their what income do they have? How much access to resources do they have to actually make sure that their children are fed and able to get to school on time and with adequate clothing? And so our biggest issue is that we need to see child protection as an issue of poverty, and poverty as an issue of child protection. And we need to stop thinking that there are people over there, a small number often, of very troubled, very dysfunctional families who harm their children, and that they are very separate and completely different to other families. And in fact, when we look at things like if you look at how the child protection system has developed, that 75% of the plans that are made are well, this was one study I read, but I know that the majority of plans that are made are to do with neglect or emotional abuse. They're not, so we need to drill down and look at what do we mean by neglect. Is it parents intentionally not feeding their children? Is it them intentionally not clothing their children? What do we mean by emotional abuse? We actually know, to be honest, that is often about children being witnessing domestic abuse, which is a huge driver of child protection demand. But actually, again, when you look at the research on the relationship between child protection, between domestic abuse and poverty, there is a very strong link, and it is not something that we have done enough work on. We need to look. There's a body of very good quality research now that suggests to us that poverty, that while domestic abuse occurs across all classes and cultures, not all women are equally vulnerable. And there are lots and lots of ways in which women with financial resources are able to absent themselves and able to manage their lives in a safer way. Vulnerability is a key driver. Financial vulnerability is a key driver of domestic abuse. Moreover, there is some very good quality research now on the links between men's inability to access the breadwinner role and their engagement in abuse. So it's about us bringing the social, if you like, back into social work policy, and I'll come on to practice in a minute, and starting to think across the piece, what do families need to look after their children safely, rather than what is this family not doing, or what are they doing that's harmful to this child? So it's a very different lens. In terms of practice, I think one of the things that has been very, very missing from social work practice, and I'm talking just about social work here because we're the lead in child protection, but of course there are many other agencies involved in child protection. But the things that are missing, as you found in your case study work often case, are we actually don't sit down and look at, for example, we used to have a framework for the assessment of children in need and their families, and that was a triangle that didn't just look at how the parent were or weren't getting on with the child and how the child was manifesting distress or whatever. It also located that family in the environment in which they lived. We need to start looking at how much money do people have to live on? Are they getting their entitlements to their benefits? We know from other countries there is good research that suggests that even small amounts of income help can support people to care more safely and improve the quality of life within families. So we need to say to people, what's happening with your income? How able are you to manage these dreadfully complicated forms that they now have to fill in? Particular issues for parents with disabilities, actually. We also need to start looking at things that are linked to poverty, poor housing, unsafe housing, insecure tenancies, people being moved away from sources of support. We also know, for example, that shame is a key feature of poverty. Across the world, there is such reliable research on shame. Shame is very, very bad for people in terms of affecting their ability to feel safe, to feel competent, to feel that they can manage their lives. It has particularly complicated and devastating effects on parenting. Parents who feel ashamed of not being able to provide their children with what they think they should be and with what the wider society says they should, don't tend to be good parents, or they tend to struggle to be good parents. Many of them succeed extraordinarily well, but it is harder and harder. there are lots and lots of safety nets that are not available to people who live in poverty. They don't have rich relatives. They don't have people they can go to when they get into trouble. So they have to financially. So they often end up in a vicious circle. And there will be a lot of people now out of the post-Christmas period who will be really worrying about how they're going to pay off the loans they took out to manage the Christmas period. So I think really key. So to summarize my bit, really key issues at a policy level, you cannot continue to drive more and more families into poverty and continue to have food insecurity, have housing insecurity, and not have really big implications for the child protection system. We have to think across the piece, and we have to think holistically. As social workers, we need to really return. I was taught that we saw people in environments, that we saw families in environments, that social work was about that person and environment interface. We have to really, really re-engage with that aspect of our values and that aspect of our thinking, and stop seeing people in a very decontextualized and disembodied way. That means that we have to think about approaches that are not just about manualized programs, to do with parenting programs, although parenting can be a real help. Parenting programs we could all do with help with parenting. That cannot be a substitute, or a technique can never compensate for building a good society. And we need to build a good society to ensure that the kind of inequalities we found in this study do not continue. Oh, and there was one last thing about the policy thing. I think as Paul started this by talking about health inequalities, and I think that there is a measure of acknowledgement across the policy piece that there are health inequalities and indeed in education inequalities, that we're not all born equal. And I think that this is something that is really important that we start to really, really engage people with. We're not born equal in terms of our educational capacity, in terms of how soon our parents will or won't die, but we're also not born equal in terms of our ability to live safely within our own families. There are profound inequalities across the country in relation to children's most basic rights, which is to a family life and to having their identity and community needs respected and recognised.
I think Brigid's account has made it very clear that this isn't a simple issue, and it's not just about social workers practicing differently, although that's a part of it, but we're talking about a systemic change, a change in the whole system. So that's from national policy, national and local policy. It is about practice. It's about the data that we collect that informs management decisions about child protection. It's about the education system and the skills that workers have. It's about research, so we understand things better. And it's about the inspection system. At every level, every element of the child protection system needs to take on board this inequalities perspective if we're going to really shift what's going on for children. And I think we have begun to shift the terms of the debate. You're just beginning to see in policy documents and discussions in all of the 4 countries an inequalities perspective in the discussion. Policy is beginning to recognize the impact of poverty on families, and that's a crucial, absolutely crucial first step, particularly in England. And we're beginning to see in some of the countries concrete policy changes to reduce the impact of deprivation on family life. So, for example, in Northern Ireland now, families where they're concerned about their struggles to bring up their kids successfully, or where other people are worried about those children, they're routinely getting offered benefits checks. And in the first 200 families that took up those benefits checks, half of them were found to be not getting all the money that they were entitled to. And we know from other examples like this around the country that this is often a matter of thousands of pounds a year that families are being underpaid. And this can have a really big effect on their capacity to look after their children. And also in Northern Ireland, they're going to draw up anti-poverty practice guidelines for all social workers, not just working with children, but with adults as well, to embed anti-poverty practice in everybody's day-to-day work. Another example is it's only a little thing, but it's really important. More data is being collected in Wales about the circumstances of families that will enable this kind of inequalities analysis to be embedded in the way in which the child protection system in Wales is developed in future, so that you can begin to set policy goals and see whether you're actually improving the situation. And we've also been able to challenge the mistaken view that austerity policies haven't been affecting the quality of children's services. The most recent Ofsted annual report just before Christmas, the end of 2017, acknowledged for the first time that low deprivation local authorities have a much better chance of a good or outstanding Ofsted than high deprivation authorities. And that's clearly just not right, just not fair for the children living in those local authorities. So we do think we're having some effect, but there's obviously a very great deal of more work to be done by everybody involved in the system.
And if I can add in two other strands, we have seen in England some very positive responses at a local level to some of our findings. So, for example, some local authority social workers really thinking through the fact that families may be attending meetings actually very hungry, because the money that they would have bought their food with, they've spent on the bus fare to the meeting. And so they're starting to provide some food in a relaxed way in meetings. Some local authorities putting child poverty as a core issue in an attempt to draw agencies together in the locality to come around child poverty as a core theme and build services accordingly. We've also seen some local authorities starting to think about how they could co-locate income maximisation services with duty social workers. So we have seen some shifts at a very local level, and it will be interesting to see how those developments play out. The other strand I just want to mention is that we've also been working with families and communities in one very deprived area to understand how they experience children's services. And whilst it's early days, we're in early days in terms of the analysis of that research, what is evident is an absence of trusting relationships between families, communities and children's services. That doesn't mean that families can't articulate some very positive and important differences that individual social workers have made to individual lives. But in terms of a narrative about helping services, there's a lack of trust from the community in the intentions, the accessibility and the relevance of those services for their everyday lives.
I would just add as well that we placed a lot of emphasis in the project on dissemination and on reaching out and having conversations. But it has really helped, I find, as an educator, that we have got a body of articles that we've developed, because now in the teaching, it is really helpful to be connecting students up with a whole body of literature that's emerging. And I find personally, this is anecdotal, but I am finding that our social work students are really becoming very interested in this topic and really can see the relevance, not only for the families they're working with, but indeed for their own lives. So I think that's a really important aspect that we need to continue on, and that this BASWA initiative is really helpful in terms of, I think.
Well, there we go. Team, any more for any more?
No, I think that's it.
No. Should we do a virtual high five to each other?
The University of Huddersfield, inspiring tomorrow's professionals.